ever wonder if you'd see the corruption for yourself if you worked inside the government? Well, wonder no more, because we have someone who did actually work inside the government and did see the corruption. And now he's running to be inside the government himself. Fascinating twist of events. We're going to talk all about that right now with Muad Hrezi. He's running for Congress in Connecticut's 1st district, that's US Congress. Muad, welcome to the show.
Thank you for having me, Cenk. Really excited to speak with you and to inform some of your viewers about the corruption when you see it from the inside.
Absolutely. So I'm going to get to that in a minute. But first, you have a number of amazing stories, including why you're obsessed with Medicare for All and what happened to you when you got a lung infection. So I really want people to hear that story. So tell us what happened.
Yeah, so oftentimes people think that if you get sick in America, at the very worst, you go to the emergency room and you get taken care of. I had imagined that was how things worked as well. But at the age of 17, during the Great Recession of 2008, my mom had gotten really sick and she needed a surgery, and we rushed her to the emergency room, saved her life, but ended up absorbing $20,000 of medical debt, even with good employer-based insurance, and what people would tell you is good employer-based insurance. But I went to that same emergency room a couple weeks later. I had pneumonia, really bad pneumonia, didn't know it though. I couldn't breathe at all, and instead of being treated, I was being interrogated over my parents' insurance information, whether I could pay off this $20,000 of medical debt. I was all by myself, and unfortunately I couldn't pay it off. And so they asked me to wait in the ER waiting room for over an hour while I literally couldn't breathe at all. Ended up collapsing, convulsing, nearly was gonna die. And then a team of about 6 doctors converged on me, and thankfully I'm still here to tell the story. But that's the harsh reality of our healthcare system, and it's what inspired me to get involved in politics. It's what inspired me to really center my work around Medicare for All and trying to do away with this profit-hungry healthcare system that we have right now.
Yeah, that's almost exactly the story that happened to Amy Villa's daughter. So she's also a progressive Democrat running in a primary. She's in Nevada, and she was on the show just last week, and her daughter did die in a story just like that, where they wouldn't take her because of insurance. So it's no joke at all, or no exaggeration at all, that you really could have died there because of privatized insurance. And one more thing about that, Muad, because when you see people on TV talking about, well, if we have Medicare for all, universal health care, single payer, we're gonna have long lines. How mad does that make you, given that you actually nearly lost your life because of a line, because of privatized insurance?
Yeah, it's infuriating. Honestly, we can even do away with the fact that there was a line. In my case, the emergency room was empty, and it was just pretty much the fact that the hospital didn't want to treat me because they wanted to discriminate against the fact that I was low income and probably couldn't afford the expensive care that they were gonna provide. So even with our current healthcare system, when we don't have lines, there's a gatekeeper, which is an insurance company and hospitals, administrative staff that don't let you get the care you need. But what I tell people is that we're the world's wealthiest country. We can definitely provide care to everyone at a high quality rate. We see other countries across the world doing it. And so there's no reason for there to be a line, but there currently is a line, and that line, instead of being based on medical necessity, is based on wealth, which makes no sense at all. It's a completely backward system.
No question. Democratic consultants tell you not to put Medicare for All on your website. You're supposed to soften it and say universal health care, or we like health, that kind of soft stuff. But you do proudly declare that you're for Medicare for All. Did anybody try to talk you out of it?
Honestly, we don't really talk too much to the typical consultants, so rarely talk to consultants in general. I think that the consultant class has gotten us in a whole lot of trouble. I just speak to voters and share my passion and vision with them. And I've dedicated my life to learning about our healthcare system, and it just makes a whole lot of sense to reform our system to Medicare for All, single payer type system. And we're doing this all, Cenk, in the insurance capital of the world, which is Hartford, Connecticut. And so when we win here, we're gonna prove to everyone that you don't have to water down your proposal when it comes to healthcare reform, that you should be bold, imaginative, and you should declare your values. And if you believe healthcare is a human right, put the policy proposal that actually shows that. And so we've had tremendous success even here in Hartford, Connecticut. People get it. Health insurance is just essentially a financial scheme built up by these big Wall Street funds, and it's just meant to provide a system that keeps people away from the care they need.
Yeah, so I will tell you this: if you win in the mecca of privatized insurance, running on Medicare for all, that will be a political earthquake. And I know how well you're doing. We'll get to that in a second as well. But now let's go to the story that we promised. So you're in Connecticut. You go through this traumatic situation. You decide politics is the right answer. So you go and work at Senator Chris Murphy's office. What did you do there, and when did you start to get disillusioned?
Yeah, so I was brought in primarily for my healthcare background. I studied public health, and so I worked on his health policy team. And Senator Murphy sat on the actual health committee, which is the primary healthcare committee for the Senate. So I worked a whole lot on healthcare, worked on different issues as well, such as Social Security, foreign policy, housing. But when I was there working on healthcare, I started to get disillusioned. I kind of went into it knowing what the system was like. But what broke the camel's back is that given the fact that we had a pandemic, and I felt like Democrats had as much leverage as they were ever going to have to be bold and try to deliver, I just felt like we weren't meeting the moment at all. We weren't taking a stand, and even Democrats were fighting Bernie on things like $600 unemployment, and he was the only one who was willing to kind of draw a line in the sand and say that we shouldn't allow people to starve to death during this pandemic. And so at that moment, I realized there was no way that we were going to get the change that we needed with the current political class. We needed a new wave of elected officials who were actually going to, think big, think bold, and not be beholden to corporate interest and corporate money, which to me is the biggest challenge that we face right now.
So Muad's not playing because his TikTok channel's at no corporate money. So it's pretty clear that you're not taking corporate money. I'll give you that one. And so, but I'm curious, what did you see inside the senator's office? And Chris Murphy is not necessarily the bad guy or even a bad guy. He's just the typical United States senator. And so, you talk about the system being rigged, but we see the results of that. But how does it get rigged in the first place?
Yeah, so I can give you one example, and this is bigger than an individual senator or an individual House member. It's a system that's at play here. But one example is there was this issue with surprise billing. So essentially, Wall Street realized that there was weak regulations around some health insurance laws, and that what they could do is buy up a bunch of emergency provider practices, and they can catch patients at their most dire circumstances when they're visiting the emergency room, and that they can bill them out of network and charge them a whole lot of money. And their insurance company wasn't able to do anything to stop that from happening because it was considered out of network. And so they found this loophole, Wall Street folks, and they started buying up a bunch of these practices. And then Congress realized what was happening and rightfully was interested in stepping in. So the Senate came together. We were finally going to put together a proposal, and it passed quickly out of the healthcare committee. But as soon as we started getting some momentum, Wall Street poured in a couple $1 million to advertisements in some key states, and all of a sudden Congress grinded to a halt. Not only that, a couple months later, Congress started, or the Senate, I should say, started moving again. What ended up happening then is after Wall Street realized that money wasn't going to be effective, they ended up donating a bunch of money to some key members on the House side this time. Richie Neal was probably the most prominent of which. They ended up donating, I think it was maybe $50,000 to his campaign re-election committee. All of a sudden, Richie Neal has an epiphany that he now wants to come up with a new idea that stalls the entire kind of process. And so now we have to wait again. What we end up realizing is that this new process is a process that favors the Wall Street folks who caused this problem to begin with, gives them a more favorable reform. And so what ends up passing is the reform that favors Wall Street. So to kind of put this in a quick, a summary 3,000-foot view, Wall Street rigs the system by finding this practice that they can exploit. When Congress wants to step in, they pour a bunch of money to slow it down. Once they slow it down, they find the right members to target. They pour money into their re-election campaign committees. They get them to propose the idea that they prefer, and then they essentially buy out the rest of Congress and are able to actually get that policy that they want. And so now people are still paying more for the care that they receive because of this huge scheme and machination that Wall Street devised. So that's kind of how Congress works. It's a soft corruption that it pervades everything that happens there.
Yeah, I don't think it's so soft. I think it's an open auction. Richie Neal just takes bribes. They call them campaign donations, but they're bribes. And if you guys are wondering who's this awful Republican Richie Neal, nope, he's a Democrat. And he's one of the most corrupt members of Congress, and he is celebrated by Democratic leadership. He is in Democratic leadership, and he's of course celebrated and feted by mainstream media. They love his corruption. They think it's savvy fundraising. So Muad, you're also doing fundraising, and in spectacular fashion from the grassroots. You've raised $420,000 last I checked. That is unbelievable, and that gives you a real shot at beating a 13-term incumbent John Larson in the race that you're running in Connecticut's 1st District. So just real quick here before we run out of time, tell us your battle plan. How do you plan to beat an incumbent that's so entrenched?
Yeah, and to put this race into context, I'm running against the longest serving member of Congress without a primary challenge in the entire country. The incumbent, my opponent, has been in office since 1999, was elected in 98, never once been challenged. This is a Democratic stronghold district, so virtually no accountability. And he's also the 5th highest recipient of corporate PAC money out of all the House Democrats. So that's the person we're challenging. We've taken a different route. No corporate money, like you said. We raised a ton of money. Our plan is simple. We know our message is popular. We've been knocking on doors. We've been talking to voters, and we're winning the majority of these decided Democratic voters who typically show up to the polls. And the message is simple. We're not going to get anything done that we want on this big structural change that we talk about, whether it's pharmaceutical prices, whether it's higher education reform, unless we get corporate money out of politics. And to assume that the person who's part of that problem is going to fix it is just insanity. And so voters get it very quickly when we inform them of these kind of basic but highly important facts. And they understand it's time for a change, and they're excited to have new blood in Washington. And so plan is simple: continue to build and mobilize this grassroots army that we've been preparing for months now. Work hard to get our message out there. And we know that as long as people hear our message, that we'll win this election. And we expect kind of the incumbent and folks to maybe start trying to play some dirty games. But as long as we stay focused and our campaign stays focused on the message, I think voters are going to be really excited about what we have to offer.
Yeah, so I'll say one last thing to the audience. So mainstream media lies to you on a regular basis, and they tell you, oh, incumbents are so important because they can deliver the goods for your district, right? Well, it's been 26 years that Larson's been in that district. How's that working out for you? Do you guys have Medicare for all? Do you have universal health care? Do you have $15 minimum wage? Do you have voting rights? You don't have any of those, do you? Isn't it weird how the mainstream media actively lies on behalf of establishment Democrats? How does it help to have an incumbent Democrat in an office like that? I've never seen it help. All it does is it helps them stuff their pockets full of corporate cash. You know Muad's on a level. His handle on TikTok, like I said, is at no corporate money. He almost died because of the corruption, and so obviously it's personal to him. His website is Hrezi.com. That's Hrezi, Hrezi.com. Obviously, if you're watching later on YouTube or Facebook, we'll have the links in the description box, and you can volunteer, donate, etc. Muad, thank you so much for joining us. We appreciate it.
My pleasure. Thanks for having me.
No problem. Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.